Digital health innovation has grown exponentially over the past few years. But what does it actually mean for the consumer? People who have chronic pain are often waiting for long periods of time to see someone who may be able to help them. Often, they are given more medications or interventions that actually end up making their pain worse. This is called injustice in the healthcare system. I would like to share with you some of the other problems that cause injustice for people with chronic pain who are on workers' compensation and income protection insurance. Injury insurance schemes exist to help people in times of need, yet health and return to work outcomes are worse for people who receive compensation than those who do not. For people who are on claim with chronic pain, there are many forms of injustice influencing their stress levels and therefore their pain. Feelings of injustice can come from a number of sources, and it fuels perceptions of not being believed or heard. It can come from individuals, their beliefs, culture, family structure, problems with previous experiences. It can come from the health system, from doctors, physios, exercise physiologists, and maybe even psychologists. It can also come from contacts bias and their family, friends, and acquaintances. There are also injustices pressuring from the employer. So their boss might want them to return to work sooner than they're ready, return to work coordinators, and fellow employees. There are also pressures coming from the case manager, in the injury management advisor and the insurer, and even from the rehabilitation provider might have different policies, education, previous experience, and lack of communication skills. I'd like to introduce you to Denise. This is our case study here. She's a 34-year-old female who is working in a well-known supermarket, and she rolled her ankle. She kept working and over coming months did it again 5 more times. In 2018, she was commenced on opioids, and in 2021, she was actually diagnosed with a severe condition in her ankle which required surgery. In February 2021, she was able to have a total reconstruction of her ankle. And then post-operatively, she developed an infection. In April, she was seen by a pain specialist and she was diagnosed with complex regional pain syndrome of her left foot and little toe. In 2021, in September, she commenced the Amelio Health Pain Management Program. I'm sure you can see some of the injustice in this already. 3 years to be investigated and surgery to repair her ankle, long-term opioids prior to surgery, post-op infection, just to name a few. So during the Amelio Health Program, Denise was given education on the medications she was taking and the long-term consequences. We also observed her sleep, disturbance and activity levels. With live 24/7 support, Denise was able to observe her own biofeedback from her wearable and discuss this with her health coach and a rehabilitation consultant. The Amelio Health Program is heavily embedded with evidence-based practice, so we measure constantly how people are progressing in a number of psychosocial scores. Over the last decade, an increasing body of research has shown that proactively engaging people's underlying beliefs and values, such as honesty, respect, fairness, compassion, and collaboration, substantially improves outcomes for people with chronic pain. So we use a number of tools. We use the Pain Self-Efficacy Questionnaire, we use the Injustice Questionnaire, we use the Pain Catastrophizing Score, and we use the Chronic Pain Acceptance Questionnaire. And we combine this with their wearable data and data from the Promise 29 score, which looks at how pain is impacting a person's life over many domains. So what is it that we do? We want to convert research into practice. The program is driven by data, with analytics supporting live integrated learning with the rehabilitation consultants. We benchmark against the International Association for the Study of Pain core competencies in learning, which is also aligned with the National Strategic Action Plan for Pain Management in Australia. We want to use standardised outcome measures, assessment tools that are built into the program and the app-based delivery of this model. It incorporates wearable devices and therefore utilises machine learning of all of the data that is captured on each individual. We have 24/7 qualified health coaches in the live chat space ready to support people who have chronic pain and their rehabilitation consultants. We empower participants to make healthy decisions that assist them to reclaim their life back from the effects of chronic pain. So what do we cover each week? So we look at the learning pathway in a number of different ways. We want the person to explain their story and where the pain actually started and how it impacts their life. And this is then shown to them at the end of the program, where they can compare how they've recovered over the 8 weeks. We look at tools for change, we look at entrapments and treatments, and we look at planning out their recovery and how they can sustain that recovery. We also look at rewiring the brain and changing the way they think about things so that they can move forward. Building resilience is a very important part of our program, and we measure that now with our wearable devices and heart rate variability. And then at the week 7, we get them to reflect back on what they've learned and how far they've come. And what are the next steps in week 8? Where do they go from here? Data drives behaviour change, and using live data from wearables, a daily pain diary, and behavioural medicine tools, we are able to target the specific factors that are contributing to the distress of our clients. We also provide an integrated learning path for the rehabilitation consultant as they journey through the program with their client. This provides just-in-time practice decision support that is implemented at the time it is needed, reducing the mismatch of workplace workshops and implementing evidence at the coalface. So what about Denise? By week 4, she'd ceased all of her medication. She was attending physiotherapy 2 times per week, and her pain score had reduced to 4 out of 10 from 8 out of 10. In week 6, she had increased her pacing at work and had a pain score of 0 out of 10. She had removed a brace that she had been wearing for the past 3 years. Week 8, she had a pain score of 0. She had increased her hours to full-time on the floor 50% and no brace at work. She took her nephews fishing, which was one of her really valued things that she wanted to achieve. And she'd lost 10 kilograms in weight.
Ankle for injury, the pain intensified, had surgery, colour, the pain, the sweat of the ankle just kept intensifying. It put me through to a nerve pain specialist, and she said that it's pain syndrome, complex syndrome. My insurer, my case manager, maybe give this management recover program a go. Yesterday I went to Penrith Plaza, went back to the car, got home, took my shoes off, took the sock off. No pain.
And how did you feel having the chatbot whenever you needed it?
Now that was the biggest help at all, because when I'll be laying in bed around 11:30 or midnight, the nerve pain just starts shooting. Having the reassurance that within a couple of minutes you saw a big bang, guardian angels from social media kind of view.
And how did you feel having your rehabilitation consultant actually learning the same things you were learning?
Again, hands down, I don't think I could have done without her. Since that a couple of weeks ago, I think week 6, week 7, tasting is key. Because I was skeptical at first, but at least people know about pain, the help. People that are actually listening to you, that actually care just about looking after you and what's good for you and what benefits you, what helps you, what makes you get up in the morning, what makes you go to sleep at night. Someone does care.
So if you'd like to contact us, you can reach us on Amelio@ameliohealth.com or through our website.